Now on to the fourth part of the video, how to obtain health insurance if you are currently uninsured. So I'm just going to talk a little bit about all the terminology you need to know and how to end up actually choosing which plan you want out of all the plans on the healthcare.gov website. Okay, cool. So if you are currently uninsured, under Obamacare, you must have insurance by this extremely important date. What is this? Okay. Which is March 31st, 2014, which is really coming up. So you must have insurance by this very important date, March 31st of this year, or else you will have to pay a penalty. If you want more information on like how to get out of health insurance, that was in part 2 of this video, so you can check that out. But if you want to avoid the penalty, you need health insurance by March 31st, 2014, if you are currently uninsured. So your options for getting health insurance are the state-run exchanges, or some are federally run too. It doesn't matter. Federal exchange. The private health exchange. This is an I. And the third is directly from the insurer. Okay. So your best bet is probably with number 1, the state/federal exchange. And since this video is about ACA, I'm going to mainly focus on how to get health insurance from the state/federal exchange. So the number 1 thing you should do is go on healthcare.gov to see your options for number 1. You can also see your options for number 2 and number 3. The first thing is to get a good sense of your options, the specific quotes for the plan that you want from each of these 3 places. So how you get your options from the state/federal exchange is you go on healthcare.gov, which is right here, and then you click this blue button, see plans before I apply. And then they're just going to ask you a bunch of questions that you fill out, very basic stuff about like your income, how many people are in your family, their age, and then you basically get this right here. You get the sea of plans with like a bunch of complicated terminology and like a lot of numbers and stuff. So we're going to discuss what all of this terminology means and how to decide which plan amongst your 6 health plans that is best for you. Okay, so now on to the terminology, which really looks a lot harder than it actually is. So starting out with copay. Copay is just the amount of money you pay for every service. So if we look on the ACA website, right here. So if you pay, every time you go to the primary doctor, you pay $25. Every time you go to the specialist doctor, you pay $45. Every time you have a generic prescription, $15. And every time you have an emergency room visit, you pay $200. Very straightforward. Just the amount of money you pay. Now, monthly premium is the amount of money you pay every month. So if you look here, they're going to have this big bolded thing. Like under this Blue Saver Silver plan, you will pay $246 every month. And the really important thing to remember about this monthly premium, which I'm going to have a different color for right here, is that your monthly premium is the same regardless of how much healthcare you use. Regardless of healthcare. HC stands for healthcare. I'm just going to abbreviate. So if you say you go to the doctor, I don't know, 50 times a month, your monthly premium under this plan is still $246. And say you just don't visit the doctor at all that month, you are in tip-top shape, kudos to you, but your monthly premium is still $246 a month. when you have that insurance contract for like, say a year or so, your monthly premium is going to remain the same every single month because you are locked into that contract. So monthly premium does not change regardless of how much healthcare you have. That's important. The third thing is the deductible. So the deductible is the amount of money. These are all amounts of money. That after which your insurance company, I'm just abbreviating, helps you. So deductible, so basically insurance companies have this policy. So say you have a deductible of $3,000 per year. Your insurance company isn't going to help you pay a penny of your healthcare costs until you spend $3,000 that year out of your own pocket to pay for your healthcare costs. So only after you have paid $3,000 out of your own pocket for healthcare costs, then only will your insurance company start helping you. And when the insurance company is just tallying up how much healthcare costs you spent and whether or not you've exceeded your deductible, your monthly premium and your copay both are not counted towards your deductible. So the deductible is how much you spend in healthcare costs, not including your copay or your monthly premium. So I'm gonna write that here. No copay or monthly premium. So another way you could think of deductible is healthcare costs minus monthly premium, MP, I'm abbreviating here, minus copay, CP. That could also be deductible. That's there. So then this does beg the question, well, how much will your insurance company help you out? And that's co-insurance, which is, okay, so co-insurance is basically the percentage of healthcare costs you pay after a deductible. So to do this with an example, let's say you have $11,000 in healthcare costs, AC's healthcare costs, because I'm abbreviating. And then let's say your deductible is $1,000. Well, to calculate your coinsurance, basically you have to subtract these because it's the percentage you pay after the deductible. So you subtract it, you get $10,000. And so if you go on the healthcare.gov website, here you're going to see stuff like 10% coinsurance after the deductible, 10% coinsurance after the deductible. So that 10% is the percentage of this number that you pay. It is not the percentage that the insurance company paid. It's the percentage that you pay. So when you multiply this by 10, you get $1,000, and this is basically the amount of money that you pay out of the bill. So coinsurance, you multiply this percent, you subtract the total healthcare cost from deductible, and from the remaining number, you multiply it by the percentage provided on the ACA website for your plan. And that's basically coinsurance. And then the last term is the out-of-pocket maximum. This is a really convenient number for you to have. All it is the deductible plus the coinsurance. Well, you might be wondering here, right here. Out-of-pocket maximum is right here. How does the insurance company know your coinsurance yet? Like you haven't bought the plan. Well, they're basically just estimating your coinsurance. It's like using statistics or just estimating what your probable coinsurance would be. And the out-of-pocket maximum is the most you're going to spend that year for that plan. It is sort of a safety net for you that like you're not going to spend any more beyond the out-of-pocket maximum for healthcare that year. So it helps you budget stuff. And then there's just and then after this, we're just going to go over the types of plans, platinum, gold, silver, bronze. So it's just those 4 types of plans. And then we're just going to talk a little bit about how to distinguish between, say, 2 of the same types of plans. And then basically you will be ready to go on healthcare.gov and buy your insurance before March 31st because you don't want to face that penalty. Okay, so on to the 4 types of plans. You'll see that I've erased a lot of stuff. So a really big misconception about the 4 types of plans is that like some plans are like better than the other. that like say platinum would be like superior to bronze, but all of these plans have the same benefits. I'm gonna write that in cap. Same benefits. The only difference about these plans is how you pay for them. So all these plans have the exact same benefit. The only thing different amongst these 4 different types of plans, this is gold, not goob, is how you pay for these plans. So with bronze, what's going to happen with a bronze plan is on average, your health insurance, you will pay 40% of healthcare costs. And your insurance company will pay the other 60%. With silver, you will pay 30%. And your insurance company will pay the other 70%. In gold, you'll pay 20%. And your insurance company will pay the other 80%. In platinum, you will pay 10%. And your insurance company will pay the other 90%. Well, if you look at these, it sort of looks like a no-brainer, right? You obviously want to choose platinum because you're paying the least, right? Well, not so fast. This is only 40% of the healthcare costs. So if you look back to our terminology previously, what's going to happen in these kind of plans is that if you're a person with, say, a pretty serious disease, I'm sorry about that, if you're struggling, say, with cancer or something like that, you will have high chemotherapy bills, you will have high healthcare costs, and therefore maybe you want to get a platinum plan, you want to pay a small amount of healthcare costs. But insurance companies with, say, platinum plan, since they're paying more of your healthcare costs, what they're going to do, oh, sorry, let me go here, is they're going to jack up these monthly premiums. If you can look here, the platinum plan has $361 per month as the monthly premium. And here in a bronze plan, it's just $187 per month for the monthly premium. And also keep in mind that the monthly premium, if you remember back to the previous part where we defined all this terminology, the monthly premium is not affected by how much healthcare you use. So say if you're a fairly healthy person, you are a young, healthy person, and you don't use a lot of healthcare a month, well, it wouldn't make a lot of sense for you to choose a plan with a really high premium, and then since you don't have any healthcare costs, your insurance company doesn't even like have to, you can pay your insurance costs on your own. So if you are a young, healthy person, if you don't use a lot of healthcare costs, you want a plan with low premiums because you don't mind having to pay a higher percentage of your healthcare costs because you don't have a lot of healthcare costs. So that's basically like how this like plan system works. Is that these have the lowest premiums. Sorry, that is really bad handwriting. These have the lowest premiums. And these have the highest premiums. And these are all somewhere in between. So silver has higher premiums than bronze, gold has higher premiums. Gold has higher premiums than silver. It's a gradient. So that's basically how these plans work. There's also something called a cost sharing subsidy. Just throwing another word out there. So when you sign up for a healthcare plan under ACA, when you fill this out, it'll tell you if you qualify for a cost sharing subsidy. The website will tell you if you qualify for a cost sharing subsidy, you have to enroll in silver. This isn't really something you need to worry about because when you go on the healthcare.gov website, I've entered in, for example, like a sample family of 4 that would qualify for this cost sharing subsidy. If you look here, these are like the silver premiums, and like the gold premiums for gold are just like way expensive than silver. So it's factored in, but just keep that in mind that like if it says you qualify for like reduced out-of-pocket expenses, this thing, you probably want to go with silver. And then, so now that we know, now that we know all this terminology right here, all this complicated terminology, and now that we know which plan is best, which level metal plan is best for us, now it comes to deciding between the plans. So say we want to go with silver. You like silver. However, we need to choose between these two plans. That is the last step. So when you want to decide between, say, like which two plans at the same medallion level that you want on the ACA website, if we go over here, say you've decided on silver, you decide between these two plans. There's like a lot of different numbers here. This is when like healthcare.gov starts getting like a lot less useful because it doesn't really have a good feature. Like I think they had like it's not like they don't really help you decide which plan you want, this one or this one. So the main thing like I would advise you to do right now is you could find a calculator online. I like this calculator. It's like money.sign-sign.com. I'll post a link in like the bottom. But what you can basically do is just go on a calculator like this or create your own spreadsheet. It's basically a lot of adding. You can enter in this monthly premium, multiply it by 12. You can estimate, your healthcare expenditure costs, and say if you like enter into sample policies here, it'll calculate, say for example policy 1 will cost like $5,100 or policy 2 will cost like $3,800. But this calculator, it doesn't work for like every plan. So once you have a basic understanding of the terminology, you can estimate basically which plan would be better for you. I'm sorry I don't have a better answer on this question to like how to choose which plan. It's sort of like this is, yeah. Okay. So I think that's pretty much it for the ACA series. Thank you so much for listening, and if you have any questions whatsoever, especially about this last step, if you have any questions, any corrections, comments, concerns, anything you want to say whatsoever, please say it. And if you have any questions or corrections, please let me know, because I'm in high school right now and I don't have particularly very much to do. So I have a lot of time on my hands. And feel free to ask any questions or any comments and concerns. It's been a lot of fun making this series, and thanks for watching it. And that's pretty much it. Happy health insurance shopping.